The mainstay of abdominal aortic aneurysm is whether the aorta should be corrected and at what size it should be corrected. So, as the audience know, the 4 trials that have been performed, UK small aneurysm trial, the ADAM trial, and the 2 trials with endovascular instead of open surgery, have suggested that aortas up till 5.5 centimeters should be left alone and operated upon them at that threshold. Those trials were some years ago, and it is right that these thresholds should not be regarded as being in concrete but re-examined. And there are data which have been found by comparing practice in the United States with the United Kingdom, which will be debated and discussed. These data suggest that there is a lower long-term mortality if aneurysms are operated on at a smaller size. So on the face of it, one lot of data says better results occur if you operate on a smaller size, but the trials all point to no benefit to the individual patients. Now, both can't be right. Something's got to give, and at Charing Cross you'll hear the answer to that. The second big question about abdominal aortic aneurysm rests on the choice to use endovascular repair. Now, I've been fairly controversial in this area and responsible for leading the group with the EVAR trials. EVAR 1 has been much discussed. If I don't give a paper, someone else will show the slides. It is being discussed. What is of concern happens after 8 years of follow-up. Now, the engineers reckoned that the devices that were put in with an average age of 74 would last at least 8 years, and these devices did, and they were early generation devices. The take-home message is these devices did very well indeed. What we found by following the patients is that an awful lot lived longer than we thought. So we're hoping that technology can help in that regard, which I'm sure it will. But the main message of that is that if you have an EVAR, then there is some risk of re-intervention. And the whole of Charing Cross will be orientated towards the follow-up period and what to do at that stage, and what to do with endoleaks and how dangerous they are or not. There'll be a whole mini symposium on type 2 endoleak and whether it on its own is dangerous. Come to Charing Cross and find the answer to that. Aneurysm is a topic of importance to all of us because a ruptured aneurysm is the 3rd commonest cause of sudden death after stroke and heart attack. We know this because of autopsy statistics. In many countries, patients have to have an autopsy if they die suddenly, and we find how commonly this is from a burst aneurysm in the abdomen. So of course we will have a session on this and the latest results. If we're lucky, we shall hear the 3-year results of the IMPROVE trial, which in itself is controversial. We'll hear these results and then take a view on whether it was right to perform endovascular or whether it wasn't right to perform endovascular. The design of the trial is discussed always, but there's much to learn from the data, and I can assure you it'll be worth listening to.